Here's why we're talking about this. We're talking about this because neurodivergent patients are dying. The average life expectancy for an autistic adult is 36 to 54 years, with leading causes being cardiovascular disease and suicide. Autistic adults have a 4 to 9 times increased risk of completed suicide. And that suicide risk is highest in those with lower support needs. Camouflaging or masking pressure to hide autistic traits has been consistently found in research to increase the risk of suicide. ADHD adults also have increased risk of premature death, 4 times increased risk of premature death. When I learned this, it was shortly after I learned for the first time at age 37 that I'm autistic. And then I learned that the average life expectancy was like that, like what I was right then. And I was the parent of a 4-year-old at the time. And I didn't know that before. And I didn't think that most of my medical colleagues knew that, including people who cared for autistic patients. And it was a hard stop. It was like, how is this possible? This is completely unacceptable. And so I quit my perfectly stable job and decided to try to do something about that. All too often, neurodivergent people receive the message that we're broken, defective, in need of fixing. We know that's far from true. And for the past 1.5 years, we've been working to change that story. And when we think about how all too often healthcare is delivered in a vacuum, as though healthcare is only what goes on in an exam room, when we know that there are so many other aspects to health: social isolation, difficulty accessing education, difficulty accessing employment. All of this is part of health. And in our first 1.5 years, we have found a huge demand, a huge unmet need for neurodivergent people in our community, for support, for connection, for a place to show up as their true selves. And we are so grateful. We have a circle of supporters who have helped us co-create this community health village, where people who have felt neglected and misunderstood by the system can show up as their true selves and experience genuine belonging with people who get it. And in so doing, they transform their lives by shifting their own lens for how they see themselves and building trust in a community and imagining the future together, a future with hope. Because now we know what's possible.